Hi, this is Misbah, and you are watching Wisdom Dose. Element-7, Chemical and Biological Agents. 1. Welcome to Element-7. In this element, we'll explore how hazardous substances and biological agents can affect health in the workplace. We'll cover how people can be exposed, the health effects of these exposures, and the control measures that can prevent harm. This includes understanding chemical hazards like solvents, dusts, and gases, as well as biological agents like bacteria, viruses, and fungi. By the end, you'll be able to explain how to assess and control these hazards in line with good safety practice. 2. Learning objectives. By the end of this element, you should be able to identify common chemical and biological hazards found in workplaces. You should understand the main routes by which these hazards enter the body. You'll be able to recognize the health effects that result from exposure, both short-term and long-term, and you'll know how to apply effective control measures based on the principles of risk assessment. 3. Chemical hazards. Chemical hazards come in many forms: dusts, fumes, vapors, gases, and liquids. Examples include solvents used in cleaning or manufacturing, welding fumes produced during metalwork, and pesticides used in agriculture. A chemical may have one or more dangerous properties. It might be toxic to health, corrosive to skin, flammable, or reactive. Understanding a chemical's properties is the first step in controlling its risks. 4. Biological hazards. Biological hazards include bacteria, viruses, fungi, and parasites. They are found in many sectors. Healthcare workers may be exposed to blood-borne viruses, agricultural workers to animal diseases, food processors to mold and bacterial contamination, and waste handlers to a mix of pathogens. Biological agents can cause infections like hepatitis or tuberculosis, trigger allergic reactions like asthma, or produce toxins that harm the body. 5. Routes of entry. Hazardous substances can enter the body in 4 main ways. Inhalation, breathing in dust, fumes, vapors, or aerosols is one of the most common. Skin absorption occurs when chemicals pass through the skin, especially if it is damaged. Ingestion can happen if food or drink is contaminated, often due to poor hygiene. Injection occurs when a sharp object contaminated with a chemical or biological agent punctures the skin, a risk in healthcare and some manufacturing processes. 6. Health effects. Health effects may be acute, immediate and short-term, like dizziness from inhaling solvent vapors, or chronic, developing over months or years, like lung disease from silica dust. Effects can be local, affecting only the point of contact, such as skin burns, or systemic, affecting the whole body after absorption, like organ damage from lead exposure. Understanding the difference is important for identifying symptoms early and preventing long-term harm. 7. Hazard communication. Hazard communication is essential. Safety data sheets, SDS, provide detailed information on a chemical's hazards, safe handling, storage, and emergency measures. Labels and hazard symbols, such as those in the Globally Harmonized System, GHS, give quick visual warnings. Training ensures that workers understand these warnings and know how to work safely with the substances involved. 8. Control measures. Control measures should follow the hierarchy of control. First, try to eliminate the hazardous substance entirely, or substitute it with something safer. If that's not possible, use engineering controls such as local exhaust ventilation or containment systems. Administrative controls include safe work procedures, training, and rotating tasks to limit exposure time. Personal protective equipment, PPE, such as gloves, respirators, or goggles, should be used as a last line of defense, not as the main control. 9. Monitoring and health surveillance. Monitoring helps confirm that control measures are working. Air monitoring measures the concentration of airborne contaminants and compares it to exposure limits. Biological monitoring checks for the presence of a substance or its breakdown products in a worker's body. for example, blood lead levels. Health surveillance involves regular health checks for workers who are exposed to specific hazards, allowing early detection and prevention of further harm. 10. Emergency response. Workplaces using hazardous substances must have clear emergency response procedures. These include how to safely contain and clean up spills, what first aid to give for different types of exposure, and how to report and investigate incidents so that lessons are learned and improvements made. 11. Summary and exam tip. In summary, chemical and biological agents can enter the body through inhalation, skin absorption, ingestion, or injection. Control them using the hierarchy: eliminate, substitute, engineer, administer, and finally PPE. Monitor both the environment and workers' health. In the exam, always give specific examples. For instance, silica dust in construction or bloodborne viruses in healthcare. That's the end of Element 7. In Element 8, we'll look at general workplace issues, including slips, trips, falls, lighting, and safe movement of people in the workplace.